Tuberous sclerosis complex is a genetic disorder that affects only a few families nationwide. In our center, we have 30 patients that we follow in our newly developed Tuberous Sclerosis Comprehensive Clinic. Those clinics are accredited by the Tuberous Sclerosis Alliance and have brought together multi-specialist teams at every center so that there are specialists who are familiar with this rare condition and can provide comprehensive services for this group of patients. Most of the children that have tuberous sclerosis have epilepsy as a part of their presentation, and that's why I've become involved with that group of patients. Our center is a level 4 epilepsy center, so we do medical and surgical treatment for patients with refractory epilepsy, and that includes quite a few patients with tuberous sclerosis. When our center was first opened, which was 2 years ago, we had that we knew of about 12 patients in our area with tuberous sclerosis, but it turns out that we have about 2.5 times that number now that our center is open and we have the capacity to take care of all of their needs. We've recruited specialists from lots of different subspecialties, including pulmonology, cardiology, oncology, radiology, urology, nephrology, and several other subspecialties to deal with the various complications of this genetic condition. And we also offer genetic counseling, genetic testing, and dermatology services. Tuberous sclerosis is a neurocutaneous syndrome, and that means that it involves different tissue types, including the skin and the brain, as primary areas of involvement. That's why it does involve epilepsy very frequently and also developmental issues like autism. It also has involvement in the heart and the lungs and the kidneys in terms of growth of hamartomatous tissue, which means tissue that doesn't belong in those organ systems, and the growth of that hamartomatous tissue causes those areas to not function properly. So there are many different specialists who might be involved in the care of these patients. And any individual patient may or may not have involvement of various organ systems. So some patients need many of the specialists, and some patients only need a few of the specialists. Virtually everybody needs neurologists, and that's why there are neurologists at the head of these centers, most places across the country. We have 2 neurologists running our group, and we partner closely with our comprehensive care clinic, who provides primary care services and care coordination for the patients and tries to orchestrate all of the different specialty appointments for the children so that we can consolidate their care and make it efficient for them to come and be seen by multiple providers in a short period of time.